me find here. Let me just, there was one I want. Oh, this one. Let's go to this one.
What is the most appropriate treatment priority?
Okay.
It's a 2-step.
All right. And everybody, make sure you're following along. Everybody.
A 72-year-old female reports weakness and dizziness.
Okay. So kind of non-specific. I mean, the dizziness I'm a little concerned with. That could be neurological. It could be an infection. It could be a lot of different things for weakness and dizziness, but keep going.
She has had black tarry stool for 3 days.
Ooh,
So I'd
now
say
that's
lower
something.
GI bleed.
Say, okay, keep going. What were you saying about that?
Lower GI bleed is suspected.
Now, is it lower GI? What is that called? What is the word for this? This whole
melena.
Say it again.
Melena.
Okay. So we suspect that this patient has melena. And what kind of situation is that? In fact, let's do that. Let's change my colors there to kind of match what it really looks like. So we're going to say kind of black tarry stools. What kind of bleed is that? Why is it tarry? So this is actually more of an upper GI bleed. And you say, well, wait a minute, it's the stool. So how is it upper? Well, the bleeding is upper. It's just that that blood is getting digested and it's coming out the other end. But the reason the color is dark is because it's digested blood versus fresh blood. Okay. Now, what is the one where you have like bright red blood coming out the rectum? Anybody? Type it in the chat. All right, so that's going to be hematochezia. And hematochezia is going to be primarily bright red blood from an upper GI bleed. Okay, so both of them are coming out the butt. It's just, where did it start from? So in melena, we have an upper GI bleed, and the reason it's dark is because it's digested blood. So let's just add that in. That's going to be digested blood. So this probably started at the esophagus. It probably started maybe in the stomach. It could have been esophageal varices. It could have been like a ruptured esophagus from a lot of vomiting. So Boerhaave syndrome, something like that. Or in the case of hematochezia, that's going to be wait, hold on. No, I did this wrong. This is not upper, that's lower. Hematochezia, that's going to be bright red or fresh blood from a lower GI bleed. So that's going to be more like the colon, the sigmoid, much lower down, or it could be hemorrhoids close to the rectum. All right. So in this case, but either way, I still got a bleed. Wherever it's coming from, it's still a bleed. And when I'm losing blood, what kind of shock could that put me in?
Hypovolemic or hemorrhagic?
Hypovolemic, specifically hemorrhagic shock. Okay. So, and shock is what kind of problem? Oxygenation, ventilation, or perfusion?
Perfusion.
All right. So I got to do something to restore this perfusion. Find me an answer. Let's start with D.
So D, give oral fluids to replace volume before transport. No.
No, because if they got a bleed, they're probably going to need surgery. And if I give them oral fluids prior to surgery, that can cause them to aspirate. That's why it's wrong. Keep going.
Administer nitroglycerin for suspected cardiac-related weakness. There's nothing in there about that, and his blood pressure doesn't support it.
Correct. And yeah, this blood pressure definitely doesn't support it, but it just wouldn't be indicated. All right, keep going.
Place her in a seated position and delay transport until a stool sample is obtained. We're not going to sit there and wait for her to poop, and we don't want to delay transport.
Hey, and smear, give me a little poop to smear on this card. Keep going.
That's outside my scope.
Right. Okay, so we're going to go with A, administer high flow oxygen. Now, that's if it's needed. Establish IV access. We're probably going to have to give some kind of fluids to get this pressure up, okay? Because what's our map in this situation? All right, so we're going to do 48 times 2 plus 84. So what's our map? Divide by 3. So we get 60, right?
60.
Okay. So is this map good or not?
Not good.
This map
No.
is definitely not good. What is our target map that we need?
Map is
We
65.
need at least 65. So we're going to give fluids until we get a systolic pressure greater than 90
90.
or a map greater than 65. If we give fluids and we're not able to get the map up, then what are we going to do?
You're gonna probably go with levofed.
We're probably going to have to go with some kind of pressure, based on your protocols. Okay, let's do another one.